Awareness Month, colon and rectal cancer, they account for about 10%, or over 10%, in fact, of cancer deaths across the country. Dr. Fred Dumas, oncologist at Brookwood Baptist Medical Center, joins us. And we were just talking in the break that you need to start getting these tests done, especially in the 40s and beyond?
Yeah, colon cancer can start at any age. I mean, there are even colon cancers in pediatric age group, but it becomes much more popular when we hit 40s and in 50s and increases until you're in your 80s.
So when you start getting these exams in the 40s, how often should you do this?
Well, it depends.
Depends on family history?
It depends on family history and what kind of symptoms you're having.
Okay.
And it really depends on what the gastroenterologist finds when he does your first colonoscopy.
Okay.
So if you have a polyp, and there are two main kinds of polyps. If you have an adenomatous polyp, those are pre-malignant. That's going to buy you a scan maybe in a year.
Okay.
If you have no polyps, then maybe you get 5 years off for good behavior.
Okay, well, it's been probably about 6 years since I had my last one, so I guess I'm due.
Yeah, it's getting there.
Yeah, okay. So what are some ways that we can get more aware of what to do about all this? And explain the procedure. It's super simple. I mean, the worst part is just drinking the stuff and going potty. Before.
There are lots of ways that people can detect colon cancer. The simplest one was what the doctor does in the office when he does a rectal examination. He will test that little bit of stool on the glove for blood. And if you find occult blood, that's one of the symptoms, one of the signs of colon rectal cancer, and that will get you a referral to a GI doctor.
Okay, so that's just something done in the...
That's done in the office.
Oh,
it's part of most of our examinations, the part we don't like when they make us bend over the table.
Yeah. Now, can your general doctor send those samples to y'all, or you have to go to a specialist?
That's something you do in the office. So you'll get that results then. That's how I ended up having to have my colonoscopy.
Okay.
Because I thought the doctor was being mean to me. Turned out it might have saved my life because they found a precancerous polyp on my colonoscopy.
Wow.
So a colonoscopy, you have to, the bad part is what you said, the prep the night before. You have to do some laxatives and fluids to get cleaned out. And then they sedate you, so it's the test itself you don't remember.
No, it's like, and it lasts that long.
And you have the best nap of your life afterwards.
You do. You go home and it's like, oh my goodness, this is like the best sleep ever.
It is.
I mean, it really is. So if you ever have it done, you'll know what I'm talking about. Is there anywhere we can go to find out more information about this?
Well, you can go to any of the websites. Brookwood has a website. The American Cancer Society has a website.
Okay.
You're looking for information about colorectal cancer.
Okay.
The key is, of course, early detection. If you can remove that polyp, you can probably prevent most colon cancer. Right now, colon cancer is the #3 cancer in this country behind breast and lung cancer.
Okay. I didn't know
we do fairly well, but there's still 55,000 people who die of colon cancer in this country every year.
Yeah, it's one of the cancers that's just completely preventable.
It is almost completely preventable.
Okay.
Yeah.
Well, thank you very much for coming
you.
in here today.
Appreciate
it. Shedding some light on this.